Let's talk about implants and lumpectomies. I see patients all the time in my practice who had pre-existing implants. They had implants placed many years ago for cosmetic reasons, and they ended up having a breast tumor removed, either benign like a fibroadenoma or a breast cancer by a breast surgeon, and they developed problems. So I'm going to argue that if you have breast implants in place and you are going to a breast surgeon for a biopsy or mass removal, you should always talk to your plastic surgeon, and here's a few reasons why. Now, there's many women out there who are not doing the proper screening for their breast implants, and so they may have ruptures that have not been diagnosed yet. I've had patients that have gone to the operating room with a breast surgeon for a mass removal, and a rupture was found, and they weren't prepared to deal with it. It's so much better if you're going to go to the operating room and you're having surgery in the area to check on those implants before and make sure that nothing needs to be addressed, because it will be the perfect time to do it. The next thing is that many women have capsular contractures, and sometimes these things can develop slowly over time and they may not even recognize how bad it is. And many breast surgeons really aren't skilled at diagnosing capsular contractures. Since you're already going to the operating room, this is a perfect time to manage the capsular contracture. Women deserve to live pain-free and not have this problem. Why not manage it at the same time? And then finally, we know that implants weaken with time and your rates of rupture go up. So if you have an aging implant and you're already planning on going to the operating room for a biopsy or cancer removal, this is a great time to switch your aging implant out to a newer, less likely to rupture model. When you have implants placed, you need to have a long-term relationship with your plastic surgeon. You need to be following up with them occasionally so that you can make sure you're doing the proper screening and that no implant problems have developed. And this is, like I said, very, very important if you're planning to go to the operating room in this area with a different type of surgeon, because they are not equipped to manage the implant problems like we are.